Prior to acquiring your panoramic image, it's important to have your patient remove all jewelry from the neck up, including any removable dental prostheses or hearing aids. Additionally, the protective lead apron should be placed on your patient. Once you've prepared your patient, simply ask your patient to step into the machine while ensuring that the unit has been appropriately adjusted for the patient's height. Go ahead and ask your patient to grab onto the support handles to help make them feel more comfortable. The first thing that you need to position appropriately is you need to make sure that the area of interest, our maxilla and mandible, are located within the image layer. The image layer is denoted by the indentation on the bite block. Ask your patient to come forward, open, and close onto your bite block while simultaneously placing their chin onto the chin rest. Double check, smile please, to make sure that the incisal ledges of your maxillary and mandibular teeth are located within the indentation in your bite block. Now that your maxilla and mandible have been placed within the image layer, the next thing to position is the patient's chin. The patient's chin is positioned appropriately by aligning their Frankfurt horizontal plane with the horizontally oriented positioning light. Positioning the patient's chin too high or too low can result in distortion of some of your anatomical structures. Once the patient's chin has been properly positioned, next you must align their mid-sagittal plane. This is done by making sure it is aligned with our vertically oriented positioning light. This ensures that our patient is neither tilted nor turned in the machine. Once we have positioned our maxilla and mandible in the image layer, positioned our chin appropriately, and aligned our mid-sagittal plane, we can now close the head stabilizing bars and help our patient maintain the position. The patient should be positioned upright during the image acquisition. To ensure that your patient is positioned upright, have your patient stand up straight and step forward as far as possible. This will ensure that the cervical spine does not interfere with the interpretation of the anterior maxilla or mandible. Your patient is now properly positioned to acquire your panoramic image. Before you acquire the image, ask the patient to swallow and place their tongue on the top of their mouth, close their lips, and to hold still. This completes the proper positioning of a patient for a panoramic X-ray on the Sirona Ortho Phos XG unit.